Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry with this week's episode of Dental Health with Dr. C. Kind of like to talk to you today about a new product, not very new frankly, but maybe you've heard of it but don't really understand it. It's called Invisalign. What is Invisalign? Invisalign is an orthodontic treatment. So if you have some spaces or crowding and you'd like your teeth squared away a little bit better, I mean, when I grew up, you went to the orthodontist and he put some metal brackets on your teeth and wires and elastics, and they really weren't something that you wanted to do way back when. You get talked into it by your parents because your friends would call you metal mouth and magnet head and a whole bunch of things that weren't all that great. I know I had trouble with it because I was playing a lot of sports, and as often as I got hit in the mouth, I was constantly, I don't know, extricating my upper lip from the brackets as they kind of smashed into them. But today there's actually an alternative orthodontic treatment called Invisalign. Now what the heck is Invisalign? Invisalign's still an orthodontic treatment. Orthodontic treatment just means you push a tooth in a direction and then you retain it there for a period of time. And as you push the tooth through the bone, it causes certain type of cells on this side to cause the bone to resorb, and the lack of pressure on the back side causes it to deposit. So you push it through and you hold it there, and the tooth stays where you put it. Okay. So, how is this accomplished in Invisalign? Well, as opposed to having brackets and things on your mouth that you can see from across the room, frankly, we make something called aligners. A liner is a clear plastic, it sort of looks like a bleaching tray. In fact, it looks a lot like this bleaching tray. I can't show you an Invisalign aligner because frankly they're so clear I don't think it would show up on the video. And this is slipped over your own teeth. And the process is designed to move your tooth a little bit every 2 weeks. So what happens in this procedure is we take some photos, we take some impressions of your existing mouth, and we send them into the company. Now the company actually doesn't even pour the impression up and makes a model. They actually scan it with a CT scanner. And then they have a digital program that makes a series of models, all designed to move a tooth 1/4 of a millimeter every 2 weeks. And then they do a suck down with this hard, clear acrylic that slips over your teeth, and you pop them in, and over a 2-week period of time, the tooth moves a little bit. Then you go to the next set of aligners. Pop them in, it moves it a little bit more. Now what's really cool about this is when I send the prescription in, the computer actually sends me back a motion picture called a ClinCheck. And what this is, it's a 3-dimensional model where you can track exactly what happens in each 2-week interval. So as you're watching it as a movie form, it's kind of cool because if you have teeth like this, they go, and all of a sudden, they're all kind of squared away at the end of this. It's a really smooth way to go about it. I had a 62-year-old, great guy, and he never really wanted me to do veneers, but his teeth were crooked and they were a little spacing. And we made him a set of these things, and his treatment was about 14 months. He didn't really realize how clear these were until he decided to test people. So he started wearing them to work, and he bought a bottle of champagne and when he instituted therapy, and he said to himself, okay, the first person that notices that I'm doing something with my teeth, I'm going to give him this bottle of champagne. But you know what happened? He drank the bottle of champagne after 14 months himself because no one knew he was in therapy at all. These can be taken off to brush and floss normally, you can eat normally, and other than that you wear them 24/7. And the results are absolutely remarkable. 85% of the cases you could do with the traditional bands and elastics and wires can be handled by Invisalign. So if your teeth are a little crooked or a little crowded or a little spaced out and you'd like to square them away, this is a really neat treatment if you put it in conjunction with some bleaching. Because often what we'll do is we'll have people wear these, get their teeth straightened around, then we'll give them some bleaching gel, they put them in the last set of aligners, and this is a great therapy. We haven't cut up any teeth, we haven't modified anything, it's the patient's own teeth in a better position and they're whitened up. If you like straighter, whiter teeth, maybe this is exactly what you're looking for. So, if you have some questions about Invisalign, you should see somebody that can provide this type of care, whether it be me or somebody else, and we'd be happy to do a free consultation here at the office, most people do. But we can show you some results, some before and after photos, and I think you'd be amazed at the way this treatment works. When I was first talking about this on TV with Fox 6 a few years ago, I actually did an entire interview with an aligner on my teeth. And the host looked at me and goes, "Well, exactly how clear are these, Doc?" And I popped it out of my mouth, and he was blown away. He had no idea through this entire interview that I had this thing on my upper teeth. So, if you'd like some treatment, and you don't necessarily want to go through the hassles and the wires and the elastics and the obvious treatment therapy that's been available in the past, Invisalign might be exactly the ticket for you. I look forward to hearing it from you. Dr. Coleman, Coleman Center for Cosmetic Dentistry. Visit our website. Talk to you soon.